Hello and welcome. Today we're delving into the fascinating and complex world of genetic disorders affecting not just hearing, but also vision, specifically focusing on those disorders that can indirectly impact the optic nerve and overall eye health. We'll explore how mutations in genes primarily associated with auditory nerve function, like DFNB59, can sometimes have broader neurological consequences, including visual impairments. The root cause of these conditions lies in our genes. Mutations or errors in specific genes disrupt the normal function of the auditory nerve and related neurological pathways. For instance, mutations in the DFNB59 gene primarily cause auditory neuropathy, a type of hearing loss where the inner ear can detect sound, but the signals aren't transmitted properly to the brain. These genetic mutations are typically inherited, meaning they are passed down from parents to their children. While the primary focus is often on auditory function, the broader neurological implications can sometimes extend to visual pathways, especially if the gene involved plays a role in the development or function of multiple sensory systems. Other genes involved in syndromic hearing loss can also affect vision, such as those involved in Usher syndrome or Wolfram syndrome. The pathophysiology is multifaceted. In the case of DFNB59 mutations, the gene encodes for otoferlin, a protein crucial for the release of neurotransmitters from inner hair cells. A defect in otoferlin disrupts this release, hindering the transmission of auditory signals. While this primarily impacts hearing, if the gene or related pathways are also involved in neuronal development or function in other areas, secondary effects can manifest. These indirect effects on vision might involve the optic nerve or related brain areas that process visual information. For example, mitochondrial dysfunction, sometimes associated with certain hearing loss genes, can impact cellular energy production across the body, including the eyes, leading to optic nerve damage or retinal degeneration. Furthermore, some of these genes might play roles in the development or maintenance of the myelin sheath surrounding nerve fibers, and if this sheath is damaged, it can disrupt signals in the optic nerve or its connections to the brain. The precise mechanisms are complex and often not fully understood. Determining the precise epidemiology of these disorders, especially the link between auditory nerve genetic mutations and visual impairments, is challenging. The prevalence of DFNB59-related hearing loss varies geographically, with higher rates reported in some populations due to founder effects. The number of individuals with DFNB59 mutations who also experience visual problems is not well documented, requiring further research. However, it is essential to note that syndromic hearing loss, where hearing loss is accompanied by other conditions, including visual impairment, is more common. These syndromic cases, involving genes like those in Usher syndrome or Wolfram syndrome, offer clearer epidemiological data regarding combined auditory and visual issues. The signs and symptoms vary depending on the specific genetic mutation and its impact. The primary symptom is often congenital or early onset hearing loss. This can range from mild to profound. Regarding vision, individuals might experience a variety of problems. These could include decreased visual acuity, color blindness, night blindness, or even more severe conditions like retinal degeneration or optic atrophy. Other neurological symptoms may be present, depending on the broader impact of the genetic mutation. For example, Wolfram syndrome presents with insipidus, diabetes mellitus, optic atrophy, and deafness. The presence and severity of these symptoms can vary widely even within the same family, highlighting the complex interplay of genetics and other factors. Diagnosis involves a comprehensive approach. Initially, audiologic testing is performed to assess the type and degree of hearing loss. Genetic testing is crucial to identify the specific gene mutation responsible. This typically involves blood tests and advanced sequencing techniques. When visual symptoms are present, a thorough ophthalmological examination is necessary. This includes visual acuity tests, fundus photography, optical coherence tomography (OCT) to examine the retinal layers, and visual field testing to assess peripheral vision. Electrophysiological tests like visual evoked potentials and VEPs can assess the function of the optic nerve and visual pathways. In cases of suspected neurological involvement, MRI or CT scans of the brain may be performed. A detailed family history is also essential to identify potential inheritance patterns. While we've primarily focused on DFNB59, other relevant genetic disorders do exist. Notably, Usher syndrome, the most common cause of combined deafness and blindness, has multiple types: Type 1, Type 2, Type 3. These types are distinguished by the severity of hearing loss, age of onset of retinitis pigmentosa, and presence of vestibular dysfunction. Wolfram syndrome also exhibits significant hearing and vision issues. Each type stems from mutations in different genes, each affecting different aspects of development and function, leading to a broad spectrum of symptoms. Currently, there is no cure for genetic disorders affecting the auditory nerve. treatment focuses on managing the symptoms and improving quality of life. For hearing loss, hearing aids or cochlear implants can significantly improve auditory perception. Visual impairments are addressed with corrective lenses, low vision aids, and, in some cases, surgical interventions, especially for conditions like cataracts. Physical therapy, occupational therapy, and speech therapy can help manage other neurological symptoms and improve overall function. Genetic counseling is crucial for families to understand the inheritance patterns and make informed decisions about family planning. Support groups and resources are also essential for individuals and families dealing with these complex conditions. Unfortunately, prevention is currently limited for inherited genetic disorders. Genetic counseling and carrier screening can help identify couples at risk of having children with these conditions. Preimplantation genetic diagnosis, CGD, is an option for couples undergoing in vitro fertilization and IVF to screen embryos for the presence of the genetic mutation before implantation. However, these options are not available to everyone and involve complex ethical considerations. The prognosis varies widely depending on the specific genetic mutation, the severity of hearing loss and visual impairment, and the presence of other neurological complications. Early diagnosis and intervention can significantly improve outcomes. While hearing loss and vision loss are often progressive, assistive devices and therapies can help maintain functional abilities and quality of life. Research into gene therapy and other advanced treatments offers hope for future therapies that could potentially correct the underlying genetic defects. For instance, gene therapy trials are underway for some forms of Usher syndrome. Additionally, research is focusing on developing neuroprotective strategies to prevent or slow down the progression of retinal degeneration and optic nerve damage.